Okay, that means mainly this and for the prioritization based question, we need to understand the scenario. That means what is the actual problem of the patient, whether the disease is related to the airway, breathing, circulation, or disability. Okay, that means
Okay.
by reading the scenario or by reading the symptoms of the patient or any sudden onset or it is a chronic condition like that, we can understand the what are the actual problems of the patient. And second thing we need to do that, we need to differentiate the patient. That means by reading the scenario we can understand whether it is a stable patient or it is an unstable patient. By looking the symptoms or the severity of the symptoms, we can correlate whether the condition is stable or unstable. And next one, we can identify any sudden onset of symptom. That means sometimes in the scenario it is written the patient has brought to the emergency department with, for example, dyspnea, okay, like that, or some other symptoms will be there. Then after some time, or they will give one additional information that suddenly patient got, for example, suddenly the patient went unconscious, or the patient complained about diaphoresis, like that. So if there is any sudden onset of symptom, at that time the sudden onset of symptom will be your highest priority. Okay, so how we can prioritize means by using the method ABCD approach. ABCD means can you please tell me?
Airway,
Uh,
airway, breathing, circulation.
then last one D.
Ah, D also is there. Airway, breathing.
D means disability. Okay.
Disability. Ah,
Uh,
okay.
Disability. These are the areas we need to focus when prioritizing a patient symptoms, need and care. Okay. So that means we know that this NCLEX are and question categories are the main criteria are we know they will assess the basic care and comfort, management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, physiological adaptation, reduction of the risk potential, pharmacological and parental therapy. These are the areas or these are the criteria they are focusing in the question analysis. That means each question will follow any of these criteria. But in any of these criteria, the main focus is what the patient safety as well as in prioritizing the need, prioritizing the care and prioritization of identifying any immediate need or any complication. Okay, that is the prevention of this complication, or to promote the safety we need to apply prioritization strategy. Okay, usually how we can prioritize the need or how we can determine the prioritization means by reading the scenario. I have already said we need to by reading the scenario we can look for is the client need any immediate attention. That means if there any worsening symptom like that, we can understand that. And also we can, if you identify, for example, if you identify or notice that the client is having hypoxia, that means when we assess the vital signs, you have noticed the oxygen saturation is 88 percentage only. So what you think? Our thinking always go with the what is the emergency management or what is the primary intervention needed for the patient to manage the complication or to prevent the ill effect. Okay, that means which intervention we need to do first, that should be our primary focus. That means the first action we need to focus. Okay, and also we need to look for the skills that the patient safety, how the patient safety can promote as well as how we can prevent the complication. These are the main areas we need to focus while prioritizing the care of a patient. That means first we need to identify the symptom, which symptom need an immediate attention, then which intervention I should act first. So third one, and what are the actions or what are the skills I should apply to promote the safety and to prevent the complication or deterioration of the symptoms. Okay, these are the areas you have to keep in your mind while assessing or while reading a scenario. Okay, any doubt on this, Ashwini? Any doubt?
No, ma'am.
Okay, so we can look for this. That means in a question, we by assessing or reading by using skimming and scanning, we will get an idea or a clarity of the patient symptoms and patient condition. And mostly, our focus is to prevent the deterioration or to prevent the death. That means if we are delaying the care, what will happen? That will invade complication or that will affect the safety of the patient. That means it can lead to life threatening complications. So our while thinking about that means always we think like an RN. That means when we read the scenario, the in that scenario there will be one nurse as well as one patient will be there. So you need to imagine you are the nurse who is taking the care of that particular patient. You just visualize that scenario, and if you are in that place, what is your first action to save the life of the patient and to promote the safety and to what prevent the deteriorating sick condition. Okay, that means main hierarchy of care are, as I said, first priority is airway and safety. That means we need to apply the airway theory. That means we need to check whether the airway is intact or patent or whether the airway is obstructed. For example, foreign body obstruction or any the client is not able to breathe properly. Like that, if you are assessing the airway, we need to manage the airway first. In addition, your focus is on the safety. That means always whatever the actions or whatever the symptoms you are assessing, you need to focus on whether the patient is safe or not, or the patient condition is getting worsened or not. Like that you have to think it. Second one, breathing. We can check the respiratory rate, we can check the saturation to understand the hypoxia. So that means if the airway and safety is intact, next we can look before the breathing. Okay, and that breathing is also intact, we can check the circulation. Okay, that means most of the scenario, ABCD is the main strategy, but in some, according to the severity of the symptoms, we can, this order will get reversed. Sometimes in some, if a client is having massive bleeding, which would be your highest priority? Massive or heavy bleeding? Is it airway, safety, breathing, circulation, or disability, which would be your highest priority in case of massive bleeding? You are getting a scenario that the client underwent for any act. Which one?
Circulation.
Yeah,
Circulation, no?
circulation will be your highest priority. Okay, that means like that you have to understand what the scenario is dealing with, and also neurological status. That means, for example, if the client is irritable, the client is unconscious, or the client has lack of coordination, confusion, like that. That is, in such cases, neurological status or disability is your highest priority. Okay, and also we can look for the expected findings as well as with the chronic condition. That means if you are in a scenario, if they are dealing about some chronic condition, for example dyspnea for a COPD client or COPD patient, that is an expected finding only. But if you are saying getting that the patient is restless, that means that is expected only. But if the client is having restlessness, that indicating severe hypoxia. Okay, like means if the we can ignore the while prioritizing the need or prioritizing the care by symptom analysis. If the symptom is an expected finding, okay, and if it is a chronic condition or it is a psychological need, in that options we can delay. That means rather, as compared with the airway, breathing, circulation, disability, the expected finding chronic condition and psychosocial needs can be the less priority as compared with the ABCD. Okay, for example, in this picture, see, first airway, how we can means understand the problem. We can look for any laryngeal edema, any foreign body obstruction, or aspiration of the food, in such cases airway will be our highest priority. Or in case of burn also, in if the burn is on the face and the upper trunk, the airway is our highest priority rather than circulation. Okay, and also we can, in case of burns, we can look for the total body surface area also. And if it the neck and chest part is involved in the burn, airway will be our highest priority. That you don't confuse with it. I will check. In case of burns, upper chest or neck, our highest priority is which one? Airway. Okay, airway.
Yeah.
Yeah, airway is our. Otherwise, we can check for the total body surface area percentage. Okay, how much, if it is affected greater than 60 percentage or 80 percentage, which one is our priority? Circulation will be our
Okay.
highest priority. Okay, that point you need to keep in your mind. And in breathing also, we can look for the respiration status, whether we can, how much is the normal respiratory rate in an adult?
80. Oh, 16 to 25.
Yeah, 16 to 20 per minute. Okay, that is the normal respiration in a adult. And also, see here, and next we can assess the circulation. How we can assess the circulation? We can check the BP. Okay, that means circulation mainly, for example, if while checking the pulse, if you are getting a weak pulse, thread pulse, and while checking the BP, if you are getting a low BP, and the heart rate, if the client is having tachycardia, all these symptoms are we're mentioning with the which one? Hypovolemia. That means decreased cardiac output. Okay, if the client is showing the symptom while reading a scenario assessment, while looking the vital signs, if you are seeing that the BP is low, heart rate is high, or the client is skin tissue perfusion is, if you are touching the client, it is cool to touch, and the skin color is bluish, that means cyanosis. And if it is a weak or thready pulse, okay, in such cases, that means there is an inadequate perfusion. Okay, that means insufficient blood supply to the all the distal part of the body. So in such cases, what we have to look for? We have to look for the decreased cardiac output. Okay, decreased cardiac output can lead to what? It can lead to shock. How? The
Yeah.
yeah,
Hypovolemia.
hypovolemia, then it can lead to hypovolemic shock. Okay, that means how it, ABC, I believe you got a clarity how we can categorize, or how we
Yeah.
can, whether it is a airway problem, is it a breathing problem, or it is a circulatory problem. Understood how we can? That means if in the scenario, if you are getting that the client is having dyspnea, and also if you are in next option, the client is having severe bleeding, or a, and there is a, what hypertension or tachycardia, like that. And in other scenario, it is saying that this is COPD patient with oxygen saturation of 90 percentage. Which would be your highest priority? Three options I am giving.
Sorry, ma'am.
First one is the severe bleeding. Okay, severe bleeding with the hypertension and the tachycardia symptoms. Okay, and the second option is that COPD patient with oxygen saturation 90 percentage. Okay,
Okay.
yeah. Third one is the patient is having what? Normal, that means the patient is undergoing for any fracture with the minimal injury. So which would be your highest priority?
Bleeding only, ma'am.
Bleeding only, because there is a shock symptoms, hypervolemic, the
Yeah.
vital signs shows there is a decreased cardiac output. That means that there is a, the patient can go into hypervolemic shock. So in such cases, circulation will be our highest priority. Otherwise, we can, because first, even each option we can apply, whether it is a priority, airway, breathing, circulation, or disability, whatever it is, we can apply the strategy in each options. Okay, and also we know that in case of airway obstruction, what will happen? That can lead to rapid hypoxia and death can occur within minutes. So that only airway and safety is our highest priority. Okay, that means this when there is an airway obstruction, it can lead to rapid hypoxia. Okay, rapid hypoxia. Then this hypoxia can cause what? Cardiac arrest, can lead to death and the death of the patient. What are the indicators? How, what that means? You, in the scenario, you need to understand how the, whether the what airway is obstructed or not. How we can understand that? By looking the symptom. One is stridor. That means if by on auscultation, if you are getting the stridor, and if there is a drooling of saliva, if the client is not able to speak, and if in case of aspiration or in case of airway obstruction, there may be choking, and all these are the symptoms which shows that the client is having airway obstruction. Understood? What are the symptoms? Stridor, drooling,
There's a
aspiration,
inability
inability
to
to
speak.
speak, and
Thing-
choking. These are the symptoms which determine the airway obstruction. Next one is we can look for any safety risk. The client is having any safety risk. Why means if you are getting a option that a depressive patient is telling, if the patient's verbalization shows that he has a plan to kill by himself, that is, if there is any suicidal ideation, in such cases the suicidal ideation will be your highest priority. Okay, and if a client is having any aggressive behavior, that is also safety for the patient. There is a risk for not only for the patient, that is the safety risk for the other persons also. So in such cases, safety is our highest priority. Understood? That means first we need to look for the airway and safety. In airway obstruction is there, we can look for any airway obstruction by using the chin lift method or jaw thrust method. We can assess whether there is an airway obstruction, and also we can auscultate the stridor, drooling, and inability to speak. And in case of aspiration, the client will get a choking. In such cases, airway is our priority. But if the client is having any safety issues which is related, if the client is having any suicidal, that is life threatening. In aggressive behavior also life threatening. Okay, in such cases, safety is our highest priority. We can do one question.
Yeah.
Yeah. A patient with drooling and difficulty swallowing is an immediate risk for airway obstruction and prioritized. How we can prioritize? The client is having drooling and difficulty with swallowing, immediate risk for airway obstruction, and how we can prioritize? Breathing means usually breathing ensures the oxygen delivery to the tissues. That means when the client is able to breathe, that means there is no obstruction of the oxygen and carbon dioxide passage through the airway. That means the tissues are also getting adequate oxygen delivery. How we can assess the oxygen delivery? By looking for the oxygen saturation. Okay, if it is less than 90, that indicates what? It indicates hypoxia. If the saturation is less than 90, that is indicating hypoxia. And also we can look for the tachypnea, respiratory rate. If the respiratory rate is greater than 20, that means that the client is having tachypnea. Okay, and if the client is using accessory muscles for the respiration, what it indicates? There is a increased work of breathing. Is it? Yesterday we have learned, no, in when we deal about. Work of breathing increased. Actually, in such cases, breathing is our highest priority. Okay, highest means airway plus breathing will be, that means we have to look for the vital signs, respiratory rate, oxygen saturation. What actually I am telling about, what are the specific symptoms we need to focus to assess the airway breathing in a, if in a given scenario. Okay, that means we can look for the breathing pattern, we can look for the vital signs, that means oxygen saturation, we can check the respiratory rate, and we can look whether the client is using any accessory muscles for the respiration. And also the important point in the scenario, if it is telling about restlessness, okay, that is the indicative or early sign of the hypoxia. That is not only in case of here, in case of neurological symptoms also. Okay, if the scenario is dealing with the restlessness, it indicates the hypoxia. Okay, so these are the points we have to notice when we are dealing with the scenario with the question. Okay, so second thing, a patient with pneumonia who comes restless and has oxygen saturation of 88%. Okay, how we can assess this scenario? That means what is the patient condition? Pneumonia is the patient condition. Sorry, select that. Okay, patient diagnosis pneumonia. Patient is restless. That means patient has hypoxia. Or already it is shown that oxygen saturation is 88 only. What is the normal oxygen saturation level?
COPD 88. Yeah,
No, it
COPD.
is not COPD. I am asking about this pneumonia.
Yeah,
How much?
92 to 100.
Yeah, actually normal is 95 to 100. If the client is showing less than 90, the client immediately need oxygen saturation. Okay. Yeah, normal is 95 to 100 percentage is the normal saturation. But if it is the client is having this SpO2 less than 90 percentage, here the client need immediate, the first management, immediate oxygen. Okay. So
Yes.
here, and only except in COPD, see in COPD, how much?
88%
To
to
92
90.
percentage is the normal oxygen saturation. 88 to 92%. These are the important points when you keep in your mind when we are assessing a patient with the respiratory symptoms. Okay, especially the
Yes.
hypoxia. How? By looking the oxygen saturation, respiratory rate. Okay, and here in circulation means what? The circulation means here the when the blood is getting supplied to different organs adequately, that means there is the getting adequate oxygen also, and they are getting adequate tissue perfusion. And what are the clinical indicators for whether the client is getting adequate circulation? What are the one clinical indicators? First thing, we can look for the
Blood
BP,
pressure.
blood pressure.
Yeah.
If there is low BP, that means if the systolic BP is less than 90 percentage, that indicates that there is inadequate perfusion. Okay, that is the clinical indicator. Next, if there is chest pain, that is also indicating there is a inadequate blood supply, hypoxia, and necrosis. In case of MI, how is the reason coming? There is a decreased blood supply because of the atherosclerosis, and it can lead to hypoxia, hypoxemia, then hypoxia, then necrosis of the tissue. And while touching the skin, we can see what are they. This one,
Food.
cool and clammy skin, we can notice it. Cool and clammy skin, and while assessing the pulse, it would be weak and thready pulse. Okay, and also if the client is having next example, hypertension and cold extremities. Okay, next the client situation is hypertension, cold extremity. What is the symptom we can expect, complication we can expect? The client is going into hypovolemic shock. So here we need to look for any the client is having any, we need to assess the neurological function. Okay, that means client is confused or restless, like that we can check it. And also we can check whether the client's neurological changes are getting worsened or not, like that we can assess it. And what the clinical indicators are, we can assess for the confusion, we can check for the level of consciousness. Okay, what are they? If the client is confused, or if the client is unconscious, or if the client is showing, because this unconsciousness can affect, can come in case of hypoglycemia also, there is unconscious can occur. So that means we need to correlate whether this unconsciousness or this neurological symptoms are related to any neurological damage or due to any hypoglycemia. Okay, like that we can immediately correlate the cause. That means if the client is showing any mental neurological function deficit, that doesn't directly indicate that the patient is having any stroke or neurological diseases. Sometimes it can happen because of hypoglycemia also, but we need to correlate. How, while reading the scenario, you can check the lab findings and look for the RBS value, whether it is normal or low. Like that you can differentiate it. Actually, when we assessing a scenario, we don't stuck on the scenario only. Okay, while and by using skimming and scanning, we will get an idea, then rush fastly you can move on with the vital signs finding, as well as you can look for the lab findings. Okay, like that there you can confirm the diagnosis of the patient. And okay, so hope you got an idea about how we can correlate and what are the things we need to look for this airway, breathing, then circulation. And next one we can look for,
Okay.
yeah, look for the how we can prioritize. That means how we can eliminate the option for a less stable, less prioritized need. Okay, that means we can, while reading a scenario, if you are noticing that there is a, see, this is when in a scenario there is new onset of any symptom, that would be your highest priority. Understood? That means even if a client is having any chronic condition, but suddenly if the client has developed any new onset of symptom, your priority will be new onset of symptom. Okay, that means in case of new onset of confusion, for example, confusion. Okay, here it is the example, the client has developed sudden onset of confusion. What it indicates, indicates hypoxia, hypoglycemia, and decreased
Hypothetical.
cerebral perfusion. These are the main indicative of this confusion, sudden onset of confusion. So here main we can look for whether it is the client condition is stable or the client condition is chronic, whether it is a expected finding or whether it is a psychosocial need. Like that we can prioritize it. And in when there is a confusion, your focus is always in which indicating hypoxia or hypoglycemia, or when there is a decreased perfusion to neuronal tissues also, you will get a means we can assess that it is due to the hypoxia. Okay, that means when we read a scenario, first we can look for whether the condition is stable. You can eliminate that option. If it is a chronic condition with stable vital signs, you can eliminate that option. If it is an expected finding, you can eliminate that option. Okay, and if it is a psychosocial need also, you can eliminate. That is that are the less prioritized options as compared with the airway, breathing, circulation, or which the mostly the hype. If the your options showing any of the options showing the client is having any effect on decreased hypoxia, the hypoxia will be your highest priority. Okay, and see how we can this less prioritized examples are, one thing, after starting the chemotherapy drug, the client is complaining that the client has nausea after chemo. That is an expected only. Okay, examples for the expected findings. And also if the client is having chronic dyspnea in a COPD client, that also expected only. And the client is dealing with anxiety or emotional stress, those who are hospitalized or those who are diagnosed with any of the diseases, they will automatically with the stress or anxiety. So that is less prioritized options. Okay, exception to the ABC. But in case of emergency, okay, that means there are some exceptions for while assessing the ABC is in case of emergency. In emergency, circulation will be our highest priority. Okay, so by understanding or reading the scenario itself, we can um, understand or we can apply the theory. In case of emergency, our prime we need to look for ABC, and if it is a bleeding related or perfusion related issue, our focus or the first priority will be circulation. Which one? Circulation is our highest priority. For example, in case of cardiac arrest, but we need to initiate the immediately we need to start the chest compression, and in case of massive hemorrhage, we need to our focus is to control the bleeding immediately. Okay, that means here we can use the approach CAB approach. C means circulation, then airway breathing. That what are the situations we can look for the circulation as the highest priority. What are the situations? Cardiac arrest and in case of massive hemorrhage. Yeah, situations. Then and also we can prioritize each client can we can correlate the condition. Each option we need to get correlated. Don't rush to the answers. Even if it is a correct answer, after reading the question you got the correct answer even while reading each option. But when we sometimes when we rush to the answer, it can get wrong answer. So we need to analyze it with each option, correlate with each option. So how we can correlate with each option? We can look for stable versus unstable. Okay, and also it is an expected finding or unexpected finding, or it is acute or chronic, an actual problem or potential risk. That means here always unstable condition will be our highest priority. Unexpected findings will be our highest priority. Acute problems will be our highest priority as compared with the chronic problem. And also actual problems will our highest priority as compared with the potential risk. Okay, that means that are the main thing you have to keep in mind while prioritizing the this care, need or any management. Okay, and how we can prioritize the task or implementation? We can select the here you can apply that P method. That means at P, do you remember? At P means
Uh,
A means assessment. Okay, A means assessment, then D means diagnosis. You just try to remember it. P means planning, then I means
Implementation,
yeah implementation, and last one E means
evolution.
yeah evaluation. So that is the what management aspect strategy we need to apply it. Okay, but you have to keep in your mind, in a routine care assessment will be your highest priority, but in case of emergency, which is your highest priority?
Plan,
In
planning,
if you are dealing, if you are getting a scenario that the client is what
diagnosis,
huh?
diagnosis,
That means if you're getting a scenario that the client is going through in a situation of what cardiac arrest. Okay, so will you wait for getting the result or will you act immediately?
act immediately.
So that means only in case of emergency we need to act first, not wait for the result or lab findings or not wait for the assessment. Okay, that is the important tool you have to apply while or strategy we need to apply in case of what here question analysis. Okay, if it is a normal scenario, which is your highest priority? If it is a
Assessment.
normal or routine care. Okay, if it is a
Okay.
routine care, which is your highest priority? Assessment will be your highest priority. But in case of Emergency, which is your highest priority, implementation or action is your highest priority. Okay, that means we need to address the problem directly. Okay, we can address the problem directly, and also we can give the care for a fast improvement. That means to save the life of the patient, or to prevent the death, or to prevent the complication. So in case of emergency, always we should act first and not wait for the assessment or the result to come. Okay, otherwise how we can plan the care by using the method assessment. That means after assessing, that means using the subjective and objective data, we can collect the information, then we can diagnose the what is the actual problem of the patient, and accordingly we can plan the care. And on the basis of priority of planning, in planning we need prioritization. Okay, in planning on the basis of the priority of the symptoms, and after that we can implement the care or give the care accordingly on the basis of priority. That means, for example, if you are giving that patient have mild chest pain, patient is having dyspnea, and the patient is not able to walk. Okay, three options are there, and which is your highest priority? See, I will give. The client is having severe dyspnea. Okay, severe dyspnea. The client is having mild chest pain. The client is inability to walk. Which is your highest priority in that? You can just assess.
Severe dyspnea only.
Yes, severe dyspnea will be our highest priority. Why? Because here mild chest pain is okay. Okay. Oh, okay, I will mark the point. Okay, severe dyspnea will be our highest priority, because mild chest pain is also but the immediate attention is needed. But here the client is having mild chest pain only. See the word mild chest pain only. And here also inability to walk. Okay, that is also the client is needed the care or assistance. But while comparing with each option, that means here it is severe dyspnea. Severe dyspnea. Severe dyspnea means it is mainly due to which one? Hypoxia. And here mild chest pain means due to circulatory problem, inadequate perfusion. And inability to walk also, the client need assistance, mobility assistance is needed. But while comparing with the three options, which is your highest priority? Severe dyspnea is your highest priority. Okay, understood how we can prioritize the care. And also, because severe dyspnea here is a emergency situation. Sometimes if the client is they will ask about dyspnea with the use of accessory muscles for the respiration. In such scenario also, which is your, the dyspnea will be your highest priority. When if for example, you don't misunderstand that. That means dyspnea in a COPD patient is a normal one. Okay, but in case of the client is using accessory muscles for the respiration, that is a emergency scenario. Okay, that means COPD patient with the dyspnea, that is a normal expected finding only. But if your client is having COPD, severe dyspnea with the use of accessory muscles for the respiration, that is a emergency situation. Understood the difference?
Yes, ma'am.
Expected versus unexpected. That means we can, I will give the example. COPD only I am taking. Okay, if the client is having dyspnea, expected finding only. Expected finding. But the client is having this severe dyspnea severe dyspnea with the use of accessory muscles for the respiration. Which is your highest priority?
Severe dyspnea with
Accessory maxillary, that is a complication one. Okay, that means it is a unexpected finding. So that means here while prioritizing the care, okay, while prioritizing, when we already learned that the COPD patient with dyspnea is a expected finding only, but if the client is using if the client is using accessory muscles for the respiration, that indicates that the client is having going into a what is complication, okay, or the client is going into severe respiratory failure, like that only it is showing. So always while correlating with the expected versus unexpected, there may be some expected finding, but some additional findings is there, that would be our unexpected one. Okay, so it is very important one while prioritizing the need. Got an idea how we can what are the frameworks, what are the strategies we need to apply by in case of task prioritization? That means we can normally we can use the method ATP method, but in case of emergency situation we should act first. That means we can implement first. Okay, and also in provide the, whenever we are noticing any sudden onset of symptom, we can act immediately for a better improvement, fast improvement. Okay, for examples I will tell you. A patient with hypoxia should have the head of the bed elevated immediately rather than waiting for the diagnostic test. That means, see here, patient with the hypoxia. Okay, patient with hypoxia means the patient is having low oxygen saturation level. Immediately, we should not wait for the diagnostic test. Immediately, first we need to raise the head of the bed should be elevated. Okay, that means the when there is a hypoxia, there is a dyspnea. So, our first priority to ease is the breathing. Okay, so rather than waiting for the diagnostic test, immediately we can raise the head of the bed. Then when to assess first, that means when we have the insufficient information, if the condition is unclear, if the problem is obvious, immediate action is required. That means when the client is going in a complication scenario, in such cases, what when the problem is obvious and here we need immediate action is required. Okay, but here then assessment when we required means when there is a insufficient information or the condition is unclear. That means we are not getting a clarity of what the condition of the patient. In such cases we can do the assessment, but if the client is showing the worsening symptom with the ABC, airway, breathing, circulation or disability, our action should be immediate action. That means we need to implement first. Okay, these are the points you have to keep. Actually all these whatever the points which I am discussing, that you can apply for the your question analysis. Any of the question analysis you can apply it. Okay, so it's very important one. Any doubt on this, Ashwini? You do have any doubt on this? Is it okay?
no, ma.
Clearly.
Yeah, yeah.
Okay, okay. Next is need. How we can prioritize the need. Okay, that means the order of this or the priority order is first we can meet the physiological need of the patient. Okay, that means food, shelter. Here we can the picture. See the we can look for the air. Okay, that means breathing, and we can look for the sleep, and we can look for the homeostasis, that means normal functioning of the body, and if the client is taking adequate intake of food, that are coming under the what this one physiological need of the patient. And then only it will go for the safety means physical safety and employment safety, like that. Next is friendship and etc, love and belonging. Next is self esteem and self actualization. Usually I have already said the warning signs with ABC: stridor, restlessness, retractions for the breathing, chest pain, pallid, diaphoresis for the circulation, confusion, decreased consciousness for the disability. If all these are intact, okay, we can look for the then next which one we can look for this need assessment, that is the Maslow's hierarchy of needs. That means to prioritize. For example, see the question. Um, the client is appropriate for discharge. Which patient is appropriate for discharge? Okay, here keyword is what are the keyword? You need to select a client who is appropriate for the discharge. The first option, uh, infection with the hypotension.
With the
Second option, pneumonia with the
no,
tachypnea. Third option, influenza with the sore
no,
throat. Last one, depression with the suicidal ideation. So, which client is suitable for a
no.
discharge? We can analyze
Influenza with
each
the
option.
source.
The client is having
Yeah,
infection, and also the client is showing the symptom of
type
hypertension. What is the patient is able to discharge?
no.
No, because infection, that means sepsis is there. In addition, patient is having what,
Hypo.
hypertension. So there is a risk for septic shock. Is it?
Yes.
Yeah, so we can't discharge this patient. Second option, pneumonia with tachypnea. Already the client is having lung infection. Okay, along
Mm,
with the tachypnea, that means that indicates that the client is having difficulty with the
what was
breathing. Yeah, difficulty with the breathing. So we can't discharge the patient. Third one, influenza with sore throat. We know that in influenza virals infection, sore throat is a common symptom. Okay, that means the expected finding. But here, is it need to stay in the hospital? No, here
No.
the client need antiviral therapy. Even the client can take the antivirals by sitting at the home itself. There is no need for the hospitalization. Okay, that means here this is the expected finding only. Is it expected only? Expected, there is no need for hospitalization. Is it? How
Yes.
we are analyzing? There is no need for hospitalization, so we can discharge it. And last one, depression with suicidal ideation. Is this patient is
No.
able to discharge? No,
No.
because it is a life threatening. There is a and the
This
yeah,
patient will
there is the patient can kill by
have
himself. So it is a high risk. Understood? So how the rationales are coming? Here it is a life-threatening, which one? It is a high-risk patient because there is a patient has the thought for the suicidal ideation. So that is affecting which one? Safety. Here the patient safety is affected. Okay. So here the patient safety is affected. Here infection with the hypertension are also. See, if you are applying the ABC strategy, can you please tell me the which one? This the which strategy? That means is it airway, is it breathing or circulation? Infection with the
circulation.
hypertension, which is it is a
Circulation.
circulatory problem. Pneumonia with tachypnea, it is a
It is
breathing strategy.
intolerant.
And influenza with sore throat, that is an infection, yeah. And depression with suicidal ideation, there is what is affected? There is safety is affected. Okay, that means here the patient safety is affected, so it need to managed. Understood here? Which one?
Yes.
Here circulation. Here breathing. But see, that means you have applied the strategy ABC. When you apply that airway, yeah, that means here the circulation, when infection with the hypertension, that is our priority. But compared with the other option at that time, it became less priority. Okay. And second is here it is, even it is a breathing issue, but here uh, that's the priority only. I am telling about the priority. Okay, that means here the
Yes.
pneumonia with the tachypnea is there, but as compared with the infection with the hypertension, this is the less priority only. That means we can correlate each option. Here the depression with the suicidal ideation, that is the most concerning. That means here the safety is the highest priority. That means we can apply airway, breathing, circulation, disability. Okay, these are the strategies we need to apply it here. And also see which here this answer, the Ashwini should tell me the answer. Here the option is the patient, which patient should the nurse assess first? New onset confusion, nausea after surgery, influenza with fever, chronic dyspnea in congestive heart failure.
Chronic. New onset, ma. New
New
onset.
onset of confusion. What it indicates? New onset of confusion.
As unstable versus stable. Like that you are asking. Okay.
Actually,
Hypoxia.
you need to understand the rationale. That means if a client is having a new onset of confusion, what it indicates, you have to understand about it. What it indicates, it indicating about the hypoxia. We know that when the client is neurological function
No.
is getting deficient, that means that is indicating a hypoxia. Okay. And also nausea after surgery. Is it a stable or is it a expected or unexpected one? That means as
Expected
compared
one.
with when you correlate with these two options, nausea after surgery is a common one. Okay, is it? It is a expected only. So there is no need to assess first. And influenza with fever, that is also
That
expected only
expect
because it is an infection. So the client will get a word fever, expected symptom. Chronic dyspnea in congestive heart failure, is it? Less
expected
priority?
only.
No, because it
Yeah.
is expected only. Always we need to select which one first.
Prior.
Unexpected findings first. Okay, unexpected finding first manage. First we need to assess the unexpected finding. Okay. And why I am writing means that if I am telling you about that won't listen sometimes, but if I am writing you will read it. Okay, so it will easy for you to understand. Okay, is it actually how is the class going now? Ashwini, is it comfortable for you? Are you getting a clarity? Is it okay for
Yes.
you?
Yes,
Whether
ma'am.
I need to change anything in teaching style or any explanation or anything?
No. No,
Yes,
ma'am.
following it.
Yeah.
Okay, okay, okay. Thank you so much. Now, that means here the correct answer is option one. Which one? New onset of confusion. Okay. So third option. This you can tell me, Ashwini. A patient with the pneumonia. Okay. Here the
Yeah.
patient is
Okay.
having
Saturation
pneumonia
80,
and oxygen saturation is 80.
80%.
Yeah, 80 percentage only. Pneumonia, lung infection, saturation 80 percentage only. You need to select the first action. Immediate action, you need to select it. Okay, first action you need to. That is the keyword. Whatever the things I have understood and the mark, that are the keyword. In each when question analysis, you have to find out the keyword. First option, notify the healthcare provider. That means the client is having oxygen saturation 80 percentage only. That is the current problem of the patient. And also one more method is there by reading a scenario. You can use the ISBAR method while reading a scenario. How? You know that ISBAR. I have
Yes,
already.
yes. While
I means
handling
yeah, identification of the patient.
the
That is the I. Okay. Then S means situation.
situation.
Yeah, situation means current problem of the patient. Current problem. Understood? And next one B.
Yes.
B means
Background.
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 Yeah. Background means history of the any
History of the
chronic
patient.
yeah, history of illness.
Diabetes, hypertension, any surgery.
Yeah, yeah. Then A means
Assessment.
Yeah, assessment. A means assessment. Last one, R. R means
Recommendation.
recommendation. That
Recommend.
means what is the treatment of choice.
Yeah.
Recommendation of treatment. Okay, this is the important tool. You can use it for okay in a reading a scenario is bar tool. Okay, I means
Yeah.
identification of the patient. That means we can in a scenario there will be a patient name, age of the patient, and the next is situation. What is the current problem? Here the what is the problem? Pneumonia patient, and the problem is oxygen saturation 80%. So what is the question here? What is the correct or first immediate action? Notify the healthcare provider, elevate the head of the bed, prepare for the chest x-ray, provide a relaxation technique. What will be your first action?
First, we have to notify the healthcare provider, right now.
See, here the condition is pneumonia. Pneumonia means lung infection. Okay.
Uh,
And here oxygen saturation is 80%. Here the question is asking about that is not suddenly developed one. Already the patient is having pneumonia with low oxygen saturation, that is hypoxia. So as from nurses action, see we have some scope of practices. Okay, that means if the immediate action is not in our control, in such cases we can notify the physician. Otherwise we should at least we can do some first management. For example, if you are getting a scenario that patient complained with the gum bleeding after starting warfarin. Okay, what will you do first? Will you hold the medication
okay.
or will you notify the physician
Hold the
first?
medication.
First one is
No, no,
hold
hold the medication.
because while if the client is having saturation 80%, okay, we should not be delay the treatment. That means here the client is experiencing severe hypoxia, so we need to act something. Of course, we need to notify the provider, but here our first action is to promote the safety. Patient safety is our priority concern. Okay, promote safety. Okay, that means we need to manage for something. So second thing, elevate the head of the bed. That is a management aspect. You have to think while elevating the head of the bed if there any effect on this. Yes, of course, while already pneumonia there is a patient will have breathing difficulty, hypoxia will be there. By elevating the head of the bed, what can happen? The thoracic cavity will get more space, so gaseous exchange or the breathing difficulty or work of breathing can get decreased. Okay, third one, prepare for chest x-ray. Chest x-ray, we need to prepare it, but is it the first action? You have to think always. The keyword should be in your mind, because if we are preparing the x-ray, that is needed. X-ray is actually needed, but here the client is experiencing severe hypoxia. Okay, so we need to do something for management for the severe hypoxia. Okay, actually first management is oxygen only, but here is no option for the oxygen, so we can select any alternative for that. And the last one, provide a relaxation technique. So is it needed to correct the severe hypoxia as a first action? So what you just think what may be your correct answer if you're managing for a severe hypoxia?
Elevated head of the bed.
Elevate the head of the bed. That is a first action the nurse should do when because we can see, yeah, correct answer is option 2, because here by elevating the bed the client is getting more space for the lung expansion. Okay, that means immediately the client is getting lung expansion, so it will improve the lung expansion and the hypoxia can be get corrected. How the patient can breathe easily, so patient can take oxygen into the lung, so gaseous exchange will promoted, so patient breathing difficulty will get decreases. And the other actions are actually treatments are there, but it may delay the priority immediate management. Okay, that means first we need to address the oxygenation, but notify the healthcare provider, preparing for the chest x-ray by doing relaxation technique, that can delay the treatment. First we need to promote the safety of the patient, so we have to do something for to save the life of the patient. Okay, so always you have to keep in your mind, promote the safety of the patient will be our highest priority. Understood how your question is getting? Actually it is a simple question, but you have to apply the strategy, and this can be applicable for every question. Okay,
Okay.
we can address one more question. This one is okay. See, one more question is there. I said, see, here one more question is there. See, actually, this not marked. A nurse. Okay, you can read and find out one answer, Ashwini.
A nurse is caring for a four patients who should be seen first. Postoperative patient with pain score 8 by 10. COPD patient with oxygen saturation 90%. Patient with sudden chest pain and diaphoresis. Patient scheduled for discharge. Yeah,
Which patient?
sudden chest pain and diaphoresis.
Why? You can tell me the rationale for that.
Because sudden COPD patient with saturation is 90% is not means expected, like COPD
Expectedly,
patient.
so you are eliminating this option.
Yes.
And you, the
And the
postoperative
separate
patient with the pain score of 8 by 10,
that one also expected, no,
because after
maybe.
the surgery client will
Yeah,
have
they
severe
have
pain, so
patient.
that is expected, so you are eliminating this option also. And the last one you have said, patient scheduled for discharge.
Discharge patient, yeah, we no need to see means after seeing only maybe a patient is stabilized and then they are going for discharge.
Yeah, that means
So,
first we need to manage the first. Okay, that means
yes,
the if the patient, the nurse is having four patient, she need to prioritize the patient according to the need and the stability of the condition. So accordingly, which patient is the most important patient? Patient with the sudden
sudden
chest
chest
pain,
pain and
because one thing,
diaphoresis.
there is a newly onset of symptom that indicates sudden chest pain, and with the
Okay.
diaphoresis, that means the client is experiencing
Mm.
with the hypoxia also, so this patient
Yes.
need immediate
Yes.
attention first. The nurse need to visit the patient with sudden chest pain and diaphoresis first. Okay, understood how this, if you are applying all, strategies like that, the question analysis will not be a difficult one. That means, so you see, Ashwini, you can see the changes in afterwards. After this class, you can see any progress in your question analysis. How is it the options are getting a clarity when analyzing each options. Okay, you can check it and you can tell me tomorrow. Is there any improvement in your question analysis after this class? Okay, and
Okay.
also our this always the quick, you have to keep in your mind in that whenever it is actually this NCLEX are in questions, they will ask mostly the priority based question or safety based question. Actually most of the questions are priority based or safety promotion model question. Always you should able to prioritize what you need to prioritize. You need to understand correctly about the priority need or priority care, priority action, or which patient we should meet first, or the which patient need immediate action first. Other, and you can, what are the expected findings, what are the stable patients, which patient can see later, and which patient will need any attention for the what safety issue patient or neurological issue. Like that, by reading the scenario itself you have to understand that how we can prioritize the breathing, circulation and neurological status. Then we can eliminate stable, chronic and expected finding, and also we can focus on the life threatening conditions, or in last question it's sudden onset to chest pain, that is the life threatening condition. And also we need to select the actions that we should act quickly and act directly. We should not delay the treatment, we should not wait for someone to start the treatment, and we can start our treatment within our scope of practices. Okay, we can, if the client is having severe dyspnea with the oxygen saturation 88 percentage, we can start the oxygen administration. There is no need for a physician's order, that is within our scope of practices. But for starting a new medication or doing any surgery, for taking consent, that is not in our scope of practice. Always we should act immediately within our which actions limiting in our scope of practices. Okay, so here
Yes.
always do you remember in our question analysis we are applied our clinical reasoning rather than memorization. Even we learned a lot of things, but we do you memorize any topic which I taught today? No, you just applied, you just analyze each option using method clinical reasoning. If you are using this structured framework in which will ABC strategy, Maslow's hierarchy, ACP method, ISBAR method, these are the main tools which are helpful for easy analysis of a Nugent case study question or Nugent question analysis. If you are doing so, if you are doing it in a consistently, and we can improve our accuracy, we can improve our confidence, and also patient evaluation, we can do it in a correct way. And one more thing you have to keep in mind, that documentation health education and this nutrition then activity, all this will come last only while when prioritization. Okay, last priority. But see, even all these things are least priority one. But if a client is immediately after the surgery, not immediately after the surgery, if the client is starting the ambulation, that is within our scope of. Otherwise, ambulation can assist with the LPN or UAP. But if the client had undergone for any surgery, and after the surgery, if the firstly if we are starting the physical activity or walking, in such situation we should assist the patient. Okay, that are the exceptional cases you have to keep in your mind. And also always keep in mind, documentation will come last, but in case of where in incident reports, documentation is highest. We need to stabilize the patient first, but in such cases documentation will our priority. Stabilize patient, then documentation first. Okay, that means always we should correlate in what that means. Using one strategy we can't pass the NCLEX or an examination. We can apply the multiple strategy, and by practicing daily practicing questions when using strategy, that will make the or make you to clear your exam very easily without tension and fear. Okay, so if you have not started your question analysis, you can already you are doing it, but you just in coming days you can apply this strategy, especially in case of prioritization. You can improve a score. Okay, and you tomorrow you can tell me your score update. Okay, if there is any changes or any improvement in your score, you can tell to me. Okay, Ashwini, is it okay?
Yes, ma'am.
Was it effective for this class?
Definitely, sure.
Okay. Okay, dear. Thank you so much for attending. I know you came after your duty. You were so hectic. Actually, all others are also the same situation, because after the duty they are not able to attend the classes. So that they are watching the recorded session only. Otherwise, the students, the Lydia also have the same issue. Even some other batch students also the same issue. That means the work-life balance with the study is too difficult. We know that. Okay, but even then, you have spared your time for your attending classes. Actually, attending live class is more beneficial rather than watching recorded videos. Is it? When we attend a
Yes.
live classes, we will very attentive and we will think more critically. Critical thinking is needed for our NCLEX and question analysis. So we need to boost up our critical thinking plus clinical judgment efficiency so that we can crack it very easily. Okay. So,
Yes.
okay, Shani, thank you. Meet you tomorrow.
Thank
Okay, I will send some questions also in the PDF. No, in the theory, last there
you.
are some question, and I will send
Uh,
some other, in some more questions are there. I think I will show
mhm.
it to you. Actually, not in this PDF. I will send another PDF. In that there is some. See, I have sent another also. I think. No, no. In some other PDF, I have added some question. You can.
Mhm.
I will send it. Okay, I will send it, and you can go through with the question.
Okay.
Okay, okay, dear. Bye, bye, bye.
Thank you, ma'am. Thank you. Bye.
Okay, okay, bye.